All right, so what are some things that can go wrong? Well, one of those things is hypoxia or low oxygen levels. More specifically, it's oxygen deficiency at tissue level, and it may be classified depending on what is causing that oxygen deficiency. So, for example, you may have hypoxic hypoxia. This is caused by low partial pressures of oxygen in arterial blood. So this can happen in high altitudes, airway obstruction, or some fluid in the lungs, to give examples. There's anemic hypoxia. That simply means there's too little hemoglobin in the blood, whether that's due to blood loss, anemia, or even carbon monoxide poisoning, but basically hemoglobin is not transporting, not binding to the oxygen correctly. There's stagnant hypoxia, meaning that tissue is not getting oxygen because the blood is not being delivered to the tissue fast enough. So, for example, in things like heart failure, or if there's circulatory shock where all the blood vessels dilate and now the blood pressure is not high enough to take the blood to the organs that need it. Then there's also histotoxic hypoxia, so where the blood is delivered, but the tissue is not able to use the actual oxygen, and this would be a case like cyanide poisoning. Now, carbon monoxide poisoning, you find that in things like carbon monoxide, so CO, there's no 2 there. It's found in car exhaust and even tobacco smoke. I mentioned this to you in an earlier video. It binds about 210 times as tightly as oxygen to heme, which means unless you have very, very high partial pressure of oxygen, like in one of those hyperbaric chambers, no matter regular amounts of atmospheric oxygen is not enough to push the carbon monoxide off the heme molecule. So these are just levels that you would see in, just naturally occurring in non-smokers, people who live in polluted cities, or even in smokers. It's yet another reason why some smokers are very winded. It doesn't take a lot to kill somebody, so you can see that a concentration of 0.1% is enough to bind about 50% of a person's hemoglobin. This can occur like if your car is running in a closed garage. Every year here in Arizona, people are out on like one of the lakes in their boats, and they leave their engines running and they're just hanging out. Well, the engines are giving off carbon monoxide fumes, and even though they're outside, well-ventilated area, it's enough that you can actually pass out due to carbon monoxide poisoning. And of course, if you pass out just the wrong way, if someone's not seeing you, you can drown. Okay. Smokers, I think we recognize this. They have lowered respiratory efficiency. You can see in this image, these are healthy lungs here, going all the way to emphysema. These are healthy alveoli. Cigarette smoke, the particles can be trapped in alveoli, which can cause damage. And if you start basically tearing down these alveolar air sacs, you're losing lots and lots of surface area, as well as thickening the distance with which oxygen has to diffuse. And remember, the thinner the distance, the more oxygen that can diffuse. So again, you're not getting quite the oxygen delivering capacity in people who have emphysema or who are smokers. You'll notice some of the other effects are like nicotine is going to constrict those terminal bronchioles. Again, there's carbon monoxide in smoke. There can be an excess in mucus secretion. So all of these things are going to prevent the diffusion or greatly hamper the diffusion of oxygen across the alveoli and into the bloodstream. You may have heard of COPD, or chronic obstructive pulmonary disease. Basically, it's a group of diseases that makes it difficult to breathe due to blocked airflow. Very common, unfortunately. Emphysema and chronic bronchitis are the most common conditions that make up COPD, so many different things fall under this umbrella category. And unfortunately, damage to the lungs from COPD cannot be reversed. And you can see some of these symptoms. Well, asthma is when a person's airways become inflamed, they narrowly swell. Sometimes they make extra mucus, makes it very difficult to breathe. I mean, here's a normal bronchial in this image on the left, and you can see an asthmatic one. That diameter of the opening is much smaller, as well as you can see this extra mucus buildup. Again, very common. It can be life-threatening in some cases if these airways constrict enough. A pneumothorax is basically when there is a puncture in the pleural cavity and the lung collapses. So normally the pleural cavities or lung cavities are sealed. They're not open to the outside. So you're seeing here is an individual, and I can't remember now if this individual was stabbed or shot, but you can see here's the hole, and this lung has collapsed. So it should be more like what you're seeing on this side. On the right side here, this lung is collapsed and showing that pleural space. Sometimes there is a buildup of, I'm going to say, the word that came to my mind was debris, but like things like pollen or other irritants that are trapped in nasal passages, and no amount of blowing your nose is really going to clear them out, or it's just causing more and more irritation. Sometimes what's required is a nasal lavage or irrigation. You're seeing this woman using what's called a neti pot. It's an isotonic saline solution. And the water would go up basically up one side into the nasal cavity and back down the other side, effectively flushing the cavity of any of those irritants. We talked about the superior, middle, and inferior nasal concha, or turbinates. They are there to basically help warm and moisten air and also allow for this very smooth airflow that you're seeing in this diagram A. Sometimes individuals have to have one or more of those nasal concha or turbinates removed. They may have a cancer, a polyp, or it's somehow obstructing their airways. So sometimes it's a very necessary surgery. The unfortunate part is it often causes what's known as air turbulence, which can lead to things like drying out of the nasal passages. It can interfere with people's sense of smell, and you're probably aware your sense of taste. A lot of it is also tied into your sense of smell. So depending on how much of these nasal concha or again turbinates need to be removed, it can affect your sense of taste or even smell, to a greater or lesser degree. And that's what you're seeing here. So here's a normal nose. You can see all the different nasal concha. This one's, you can see now they're missing here in the inferior, so this is after an inferior turbinectomy. In this case, it's the middle ones that have been removed, and this final one is a total inferior and middle nasal turbinectomy. There are lung transplants out there. They're still pretty rare. But there are some cases where there is no treatment, and the individual either has such an affectedly low quality of life, or they're verging on death, that a lung transplant is necessary. So you can see here it's life expectancy of 12 to 24 months. So some conditions that might necessitate this are things like cystic fibrosis, chronic COPD, pulmonary hypertension, heart disease, pulmonary fibrosis, and there's many other diseases out there that may necessitate a lung transplant. Again, it's still fairly rare, although I think it's becoming a little bit more common. If you're interested in watching a TED Talk from a woman who had one, here's a link down here. She's actually an opera singer. It's pretty amazing. She lived for a number of years after receiving the lung transplant. She passed away relatively recently. In any case, the TED Talk is pretty interesting if you have time to watch it. This next one is pretty interesting. It's called congenital central hypoventilation syndrome. The old term for it was Ondine's curse. It's a fairly rare neurological disorder that basically requires an individual to constantly think about breathing. So breathing is under voluntary control and not involuntary. Like you and I, or most of us on this, will are likely not having to think about breathing. We just do it. In fact, you can fall asleep and you still breathe. You don't actually have to be conscious. And that's one of the reasons why those centers are in the medulla and in the pons, not in our cerebral cortex, right? Now, unfortunately, people who have this congenital central hypoventilation syndrome, when they fall asleep, and some of the people who are even awake, they have to think about breathing. Otherwise, if they fell asleep, they would stop breathing, suffocate, and die. So that's what this is. You can see this boy here. He's got a very severe case of it, so he's hooked up to a machine that does his breathing for him all the time. So it's not that his diaphragm is affected, his muscles aren't affected. There's something wrong with those neurons that don't fire, so he's got to consciously think about breathing unless he's hooked up to this machine. Do you remember Boyle's law? Right? So if you remember this, so you'll know, and it's kind of shown here, as we increase pressure, basically the gas is going to become compressed and compressed and compressed in a container, right? That doesn't mean there's less gas. It just means that as pressure increases, the volume is going to decrease, right? So pulmonary barotrauma occurs when, so let's just say here's a liter of air. If I were to take this, let's pretend it's a bucket, and I take this all the way down to here. So now this liter is now, what is that, 1/8 of a liter? I can easily take a deep breath, if I'm going to put my head in this bucket, take a deep breath, fill my lungs with this, what is right now 1/8 of a liter of air. Now if I move up to the surface and I don't breathe out, well guess what, as I move up to that surface, that 1/8 of a liter of air becomes 1/4, becomes a 1/2 a liter, becomes a full liter as I stick my head up, above the water. If I held that in my lungs and I didn't breathe out as I ascend, basically that's just going to expand and expand and expand in my lungs to the point where it may even cause damage. So basically you can see this. It's due to lung overexpansion when diver returns to surface without exhaling, right? And this is a real thing. Every year there's a few deaths in the U.S. due to kids kind of playing this game, depending on how deep that pool is. They'll take that bucket, they swim down to the bottom and like, oh, this is fun. I can stay down longer. I don't have to go up to the surface. I'll just take a breath out of this bucket. Well, if they're not breathing out as they go back up, and let's say you just go shooting back up, all that air expands in their lungs, and they actually they do severe damage to their alveoli. And then I'll just leave you with one last thing. So this is more just like a fun thing. You've probably all heard of a cyclops. The myth is thought to originate from the skulls of elephants. So this opening here in the skull of an elephant is not its eye. Hopefully we all understand elephants' eyes are off to the side, but this opening is for its nose. So this is actually opening to the nares, the internal nasal cavity, I should say. The nares are here at the end of the trunk. So the opening of the internal nasal cavity. However, you can kind of see how it would have a resemblance. It's almost humanoid, especially as it's on the ground with the jawbone and everything. So ancient people and elephants have graveyards where there's multiple bones of elephants kind of in a small confined space. So people thought that cyclops, as these giants with one eyes, existed. The tie-in here to the respiratory system is that all of that is due to this opening to the nose. Anyway, I thought that was kind of interesting, so I just wanted to share with you. Hopefully you found that fun. As always, if you have any questions, please let me know.